The Institute for Excellence in Healthcare and Leadership is a special platform for raising leaders with the aim of addressing the dearth of purposeful leadership and excellence in the Nigerian health sector. This year I was privileged to attend the 7th cohort of IfEHL at the Retreat Training Center, Jos, Nigeria. I arrived at the Retreat Training Center at 1 p.m. following directions on the group chat and assistance from a participant who knew the ropes. Different people arrived at different times depending on their initial location, and by the end of the day, everyone was present. Thank God for Johnny Mercies. The hall was beautifully arranged and set for business. We had name tags and got our program materials, a pen, program of events, and a beautiful jotter in a plastic folder bag. The accommodation spaces were beautiful and serene, high quality services with big beds. The CMDA secretariat staff made us feel at home. They worked around the clock while being very friendly and understanding despite our excesses. We were grouped into teams based on green, blue, and grey colors, which we later renamed as teams Zohar, Light, and Goshen respectively. I was impressed by the rotational structural arrangement of the daily tasks, which were devotion, hospitality, and timekeeping based on teams, which made everything work smoothly in a near automated pattern. Part of the program included bonding over a session of games, which started with warm-ups, tennis, and chess, followed by 3 rounds of hotly contested games, of which Team Light came up tops and shared the banana of victory. Team Zohar as runner-ups by a very slight margin, and Team Goshen followed behind. In other words, they lost. One unforgettable aspect was the meals. Perfect super tasty meals combinations and the portions, which were almost always more than enough. The facilitators for each session were clearly divinely selected, highly knowledgeable in their respective fields, and truly mastered the art of public speaking and audience engagement. We are also privileged to visit one of the most significant health facilities in Nigeria, Faith Alive Hospital, a facility where amazingly numerous humanitarian activities and interventions are ongoing with the aim of making the society a better place and reaching every member of the society with the gospel of Jesus to the glory of God. We joined the morning devotion and health talk at the facility and subsequently had a tour of the facility guided by the founder, Professor Christian Isiche, and also carried out an organization capacity assessment research at the facility. Really enlightening event. Every session was concise and deeply enriching. We started by hearing about Bethel, a starting point for every believer. We were exposed to biblical paradigms on God, time, and eternity while going through God's pictures of life, the value of a soul, and the brevity of life. A session focused on understanding the health sector in Nigeria, and another on how medicine is a ministry that we're all called into. We also learned about the health marketplace, where we were challenged to get equipped and empowered in compassion, competence, and character. Furthermore, we were exposed to the hacks of working with teams and the basics of medical missions. A very challenging session on the Christian doctor and his work was revealed to us, with emphasis that our work is an act of worship and our talents are only useful on earth. On Independence Day, we attended Sunday service at Plateau Church, where we prayed for Nigeria, sang really beautiful hymns, and took really beautiful pictures. We also joined a live CMDA Nigeria webinar on reducing abortions led by Dr. Carlo Miller, after which we rounded up the day with case scenarios and discussions on medical ethics, where we examined different worldviews and their effect on morality and medical ethics. More so, we had sessions on effective communication, sessions on stewardship and willingness, where the resource person highlighted that we should never get to a point where we can't be willing to serve. A session on taking golden steps post-graduation was well delivered. We also taught on the basics of healthcare research and effective leadership. We had further case discussions and teachings on marriage, finances, and politics. One key thing to note here is that every resource person gave room for questions and gave satisfactory and practical answers to long sought questions in our hearts. Another highlight was the live global induction ceremony with participants from across the world, during which we made beautiful group presentations. Our unique class name, Excel Generation, was announced, and we rounded up with a powerful impartation session by our father and CEO. These words do not completely capture up to half the experience. IfEHL was everything and more. I have resolved to deliberately apply all the lessons learned through the sessions and ensure that many others get to experience this life-changing opportunity. It is by far the best course I've attended all my life, and I highly recommend it to every member of the health sector who is interested in overall personal development and making a difference in Nigeria through an excellent and effective leadership. Thank you, CMDA Nigeria. Thank you, IfEHL.